we monitor a lot of health conversations in public media data, and that linking between health and nationalism and xenophobia has been dramatically exacerbated over the last 4 years. There is more misinformation and disinformation on health than there was at the height of the pandemic. Much more. So all of the initiatives that we have heard about, all of the cross-sector collaborations, all of the coalitions, they are all very important, and we have to do something, but they have not actually solved the problem. They have not made it worse, but they have not demonstrably and substantially impacted the problem. And it's not just the social media companies, and it's not just the media companies, and it's not just government. It's a thing that we're gonna have to live with now for the rest of our lives. So what that means to me is whether you're in the healthcare and medicine space or whether you're in the public health space, we have to start working more collaboratively as professionals between each other. A lot happens outside of the physician's office, and a lot happens in the physician's office. And those two things are often not very connected, even in professional practice. But out in the communities and out in the populations, I think the only thing we can really focus on that has any, that's scalable and has any hope of mitigating this is the involvement of more community leaders and the involvement of more community organizations. And HCPs, or healthcare providers, starting to be trained in how to communicate more effectively and how to understand behavioral science and behavioral insights in addition to the science that they spent years and years learning so they could practice medicine. People will always trust nurses and will always trust physicians more than anybody else in terms of health information. If we can't figure out how to scale the impact of trusted health messengers, I think the answer is no. Part of why I said no is what we're seeing in the media data is the individuals. If you are an HCP, if you're a healthcare provider, and you are incentivized for some reason to spread bad information, objectively false information, provable false information, unlike in the year 2000 and unlike in the year 2020, you are given a platform today. Yes. There are politicians that are grabbing onto the nationalism and the xenophobia and co-opting public health and healthcare, and they're finding these people and these organizations that they're often very new, and they're giving them a platform in their election or in their speeches to their constituents. So that is a very hard problem for us to solve in public health, and it's actually, it's unsolvable for us in public health. Most big health promotion campaigns are not evaluated. They're given to an agency, and the agency tells you how many impressions and clicks you got for your millions of dollars, and they have no idea if any actual change occurred in terms of a health outcome. We have to stop doing that. That is wastes of billions of dollars every single year on every single health topic. We have to take the power away from agencies and put it back in public health organizations. And when you graduate with a degree in health communications or public health, you have absolutely no idea how to interact with the modern media landscape. You know a lot about behavior change theory, you know absolutely nothing about media and communications. And those are at the top tier 1 universities. So where I've taught. So we have to actually need an entirely new paradigm shift for how health communications works. How are you going to evaluate it? And you cannot get away with telling me that you can't evaluate it. You always have to evaluate it. And second, if your approach is how big is your media buy, then you've already failed. If you are not integrated with vast networks of community organizations, vast networks of community leaders, community influencers, whatever you want to call them, then what you're creating is just a problem that's perpetuating. There's no sustainability, there's no scalability, and there's certainly going to be no impact. So, but that idea that I just shared sounds perhaps like common sense to many of you. It is not common sense in our large and small health organizations. The other thing I'd just like to mention is we need a paradigm shift as well in how we think of ourselves as healthcare and public health professionals. A lot of the people that are being given platforms by xenophobic and nationalistic politicians today have the same degrees, the same letters after their name that all of you do and that I do. And so we have to decide as a community of practice within healthcare and public health, where is the line? that we are drawing, because we have a lot of people gleefully watching the destruction of our institutions that gave them the credibility to get on Twitter and get lots of followers. But we have not figured out as a society and as a community of practice, what are the ramifications for this? What happens to this person? What happens to this organization that is doing this? And I don't have the answer, but I think that's a really big question that we need our medical boards and our schools of medicine to actually come up with an answer for.